Can gabapentin cause high blood pressure? Gabapentin is a medication commonly prescribed to treat various conditions such as epilepsy, neuropathic pain, and restless legs syndrome. While gabapentin is generally safe and well tolerated, it is important to note that it can have certain side effects, one of which is an increase in blood pressure. Although the exact mechanism through which gabapentin raises blood pressure is not fully understood, research suggests that it may be related to its impact on the sympathetic nervous system. Gabapentin has been found to increase sympathetic activity, leading to vasoconstriction and subsequently elevated blood pressure. It is worth noting that not everyone who takes gabapentin will experience an increase in blood pressure. The incidence of this side effect is relatively low and varies among individuals. Additionally, the severity of the increase in blood pressure can also vary. If you are prescribed gabapentin and have a history of high blood pressure or cardiovascular issues, it is essential to discuss this with your prescribing healthcare provider. They will be able to evaluate your individual risk factors and determine if gabapentin is the right medication for you or if an alternative treatment option should be considered. To illustrate this further, let's consider an example. Sarah, who has been diagnosed with neuropathic pain, was prescribed gabapentin by her doctor. She also has a history of high blood pressure. Recognizing the potential side effect, Sarah informed her doctor about her condition and expressed her concerns about the medication's impact on her blood pressure. After a thorough evaluation, her doctor decided to monitor her blood pressure more frequently while she was on gabapentin. Fortunately, Sarah did not experience a significant increase in her blood pressure, and her doctor determined that the benefits of gabapentin outweighed any potential risks in her case. In conclusion, while gabapentin can cause an increase in blood pressure for some individuals, this side effect is not common and varies among people. If you are prescribed gabapentin and have a history of high blood pressure, it is crucial to discuss this with your doctor to evaluate your individual risk factors and determine the most appropriate course of action.